All right, I will take a roll call. Commissioner Gerardo,
Here.
Commissioner Christian,
Here.
and Commissioner Chung.
Here.
I will say this again to you all. Commissioner Bernal may be popping in because he's interested in these discussions, and Dr. Cordero is joining us for the second item, but he's also here to listen in and possibly participate in the first. So just want to welcome him as well and thank him for joining us. The second item on the agenda is the approval of the minutes of the January 19th committee meeting.
Move to approve the minutes.
I second.
Great. Any questions or discussion, Commissioner? Okay.
No.
There's nobody on the public comment line, so there's no public comment. I will do a roll call vote. Commissioner Gerardo,
Yes.
Commissioner Christian,
Yes.
and Commissioner Chung.
Yes.
Okay, great. Thank you. Item 3 is the racial equity toolkit, and Dr. Bennett is here. Dr. Bennett, just let me know when to pull up the presentation.
Okay. Hello, everybody.
Hello.
So you are going to be really key partners in this racial equity action plan because the department is really stretched in some areas. The work that it's going to need to be done by HR and by other parts of the department is a little bit lighter in the first year because of the unpredictability of staffing and leadership for COVID. And your part is more substantial, which I'm hoping works out so that we can, as a department, get something important done without necessarily taking as big a risk on some of those other things. It's also, I think, important because some of the things you have to do are fairly foundational for what everybody else is going to need to do. You're the decision maker and the standard setter, so they will be doing things that meet that standard, but having your system in place will help to organize that work. So that's why you are a little bit more the topic than you might otherwise have been in this conversation. So go ahead, Mark, you can bring it up.
May I make a quick comment, Dr. Bennett?
Yeah.
Commissioners, for both of the items on the agenda today, I'm just offering that it's a little unusual that you all as a committee will actually be doing the work, and then when it's ready, bringing it to the full commission. So other commissions do this often, but you all actually aren't just tasked with like kind of reviewing it and then passing along, but doing work and as long as you need to, whether it's this meeting or other meetings. And if you feel like the full commission needs to do more work, to do that as well. But I also want to just piggyback on Dr. Bennett's words that you all are thought leaders here. And I think you're going to be helping even the commission be thought leaders. So I'll be quiet now and we'll.
All right. Go ahead, Mark. Okay, full screen it. Okay. So I will go into how you arrive at being the people to do this, but we're talking about racial equity tools today, and that will become clear what that is, but you are being tasked to pick a racial equity tool or assign someone to pick one, and then to have that tool guide decision-making. It will not be instantaneous, so this is the beginning of some kind or pace of phase in to become our regular process at some point within the next several years. I would certainly hope by the end of our racial equity action plan cycle, which is the end of 2023, that we will have something like this well established and be quite good at it. But I don't expect that it will happen right away or that we'll just launch it and it'll be fine. So it'll be a process, and this is the first step in that process. Go forward. So there are, as you may recall, when I went over this, I think in December or November, in December, that there are 7 sections to the Racial Equity Action Plan. Having a Racial Equity Action Plan is required for all departments in the city. There's a little bit, it's very detailed. Ours ended up being 133 pages in the end. It's got quite a number of activities. We were asked to not alter the activities, that in fact, we are meant to accomplish all of them. They are spread over 3 years, but they are in fact somewhat detailed. So the ones that apply to the commission, there are actually 14 of them, but in this case, what I've listed the three that really are the meat of it, which is establishing some kind of equity review process using some kind of standardized equity tool, adding a health equity category for the health director's performance evaluation, and then requesting information about equity and presentations to the commission. So those two, the equity action, the equity tool and the information pretty much should go hand in hand. You shouldn't be able to use an equity tool without getting the equity information in presentations, but one may precede the other. Okay, go ahead. Thanks, Mark. So there are 14 separate activities. They are subs of each other, so it is not 14 bodies of work. In this particular one, the way it's written is adopt an Office of Racial Equity assessment tool. They actually are not attached to their tool in particular, but if you don't have something, they will help you make up something. And then that's to inform decision making for all boards and commissions. And the steps we put in was request a presentation on proposed tools, consider adoption or do some kind of customization, utilize the tool in all health commission meetings and subcommittees. And then apart from that, my staff will train senior leaders and their staff in how to use the tool. The tool, it's a little bit of a misstatement to call it a tool. It's really an approach, because the tool itself requires activities which would change the nature of your work. So it is, yes, you're using the tool, but you have to have accomplished the activities in order to actually report on the tool. So it is both. So it will not be something that people can look up the day before their presentation and put the stuff in. It's the kind of thing where if we train them now, we'll see the results of it fully, probably not for many months, and partially, probably even a few months from now. Go forward. So you have a brief, I'm hoping, that everybody got about that we wrote just on racial equity tools in general, but I'm going to go over it. So there are some elements that are really like our lean or QI processes that we already do. So it's a set of questions or activities, just like an A3 is basically, and it can be, in some localities, they use a form, some places use a worksheet. Boston's got a whole guidebook. So there are different ways to do it. It identifies clear goals, objectives, and measurable outcomes. So it's wrapped up in results-based accountability in some places, but it certainly should have that quality improvement flavor of actually helping people establish concrete goals. And it should have a plan for implementation and evaluation. So proactively seeking to eliminate racial inequities isn't something that's inherent in our current QI or lean process, but is certainly central to any kind of tool. It should engage some kind of community decision-making process. So there should be community outreach, community informing, community feedback. Every tool has some element of that. It identifies who will benefit and who will be burdened. It's very like you can do an equity impact assessment. Some people do, or health impact assessment. This is somewhat the same thing, looking specifically at racial equity. And then it examines potential unintended consequences and then how to mitigate them. A lot of this is around how much do you know about your community? How much do you have good feedback from your community? So really fully using the tool requires that you have some things in place or develop some things that may or may not be fully available for all parts of the department. And so people may be using the tool somewhat and then become better users of it as they develop the underlying requirements. Go forward. So when are you supposed to use this and how are you supposed to use it? It should be used before you start anything. So it's really meant to be in the planning process. It's a planning tool, like all quality improvement, essentially. So you are supposed to have community impact. So you should be able to assess community impact as a prediction, but also get community influence and decision making. None of that can happen if you've already essentially got your program, got your funding, and you're ready to go. It should ensure alignment with the department's racial equity goals, and in this case, I would say even the city's. It can be used as an approval tool, so you can essentially use it like an equity impact report and decide if it looks like it's going to have a negative impact. We, in fact, don't approve of that. community involvement is required for some kinds of decisions, or could be, and the community involvement part of this could substitute for a community approval process. And then as ongoing evaluation. So it should include an evaluation element. So the predictions that you made about the impact and who would benefit, those can always be quantified or at least qualified, and then reporting back on the outcomes of your predictions would be a form of evaluation. And probably a good practice for, let's make this a robust thing that we're good at. And then confirming that the community stipulated elements, the community feedback that you got, actually impacted and changed the nature of the program, is also a form of evaluation. So that would be communities as actual decision makers rather than just community feedback. And that means knowing from this tool what community said they wanted to be done, and then putting that as part of the outcomes that are required of the program. Keep going. Thanks, Mark. So there are lots of them. Most of them are adaptations of each other. So the Gear Toolkit and the Seattle one are the older ones, and many of the others are adaptations of one or the other of those. The Big City Coalition was created over the summer. I participated in a little bit of that, and it's mostly was focused on COVID, but it does expand into a full tool if you want to use it that way. Long Beach has a tool. I don't even have the Boston one on here because it's mostly about community engagement and less a little bit about Boston, but other elements, but plenty of approach. So there's other elements, but there's the choice, but there are also many examples of people customizing it and making an individual tool for themselves. Go forward. Okay. So the brief that I gave you, nope, go back. So the brief that I gave you goes into a little bit of why and how you would use it. Those links should have been live if anybody wants to go look at any of those tools. I do not have, I did not attach all of them. And what I'm going to do now is just go through a couple of them and how they might look, but I didn't include all of the questions. And so you do have that just as a reference to go back to if you want to look at what any of these look like. Go forward, Mark. So many of you will have heard from me or from other people about the Government Alliance on Race and Equity. It's a national program that is part of Race Forward. It kind of merged with Race Forward several years ago. It has quite a number of jurisdictions. I think there are 200 plus separate entities. Some of them are states, some of them are cities, some of them are just single departments in a city, all across the country that are participating in this goal of correcting the role government has had in producing inequity. And so that's a fairly big role, from everything from segregation to how we budget. So they are producing tools and guides and ways of evaluating your work so that people can start to make concrete changes that they hope will reverse some of those impacts and advance equity in other ways. So their tool essentially has these steps. It is just a set of questions in the way, like if you took the architecture of an A3 off and just put it as the questions, it's very similar to that. So you should have your proposal, you should do a data review, and that is a data review for inequity. So not just what are the relevant data, but have you disaggregated it by race? Have you disaggregated it by geography? You have to know a little bit about your own history in order to know what the relevant groups to look at and what the relevant geography or institutional differences might be. There should be some kind of community engagement process. They want what they would call authentic community engagement, which means there's some role in decision making, but lots of them give you a spectrum. It depends on the project. There should be an analysis of what impact you can predict, and then a strategy for how to mitigate or increase that impact if you think it's positive. The example for that would be the example that's most commonly used is, I think it was Seattle, where they were wanting to put in an athletic park, an athletic facility in a park. They were looking at what was missing in the city's athletics, and they were going to put in a hockey stadium. And then that's great. There are it's a very popular thing everybody wants. When they looked at it, no one in that immediate vicinity was in the income level to actually play hockey. It was very expensive. Those aren't the people who are going to play it. So it essentially would have created a system where people with money would have used a park somewhere else that was not now going to be a resource to the community. So they, after doing that process, changed it. I forget what they changed it to, but they did a process of what kind of sports do you actually play in this neighborhood? What do you want? And then moved the whole idea of hockey somewhere else and replaced some other building in another part of the city where people actually do play hockey. So that kind of analysis where you don't just look at, does anybody want a hockey place? They do. But who is this meant to benefit? And is it benefiting the people who actually are missing a resource? So that kind of analysis and strategy, it shouldn't be after the fact, but it's before the fact. Having enough knowledge about your community to be able to do that analysis is a challenge. And then you implement your program, and then you have already selected what the mechanisms of accountability are, and you've made a promise, and you follow up on it to get all that information back to community. So the people you talk to have set an expectation, and then you have to have a step of going back to report to them on what you did. Go forward. The Big Cities Health Coalition, which San Francisco, we are a member with every other big city, and theirs is very similar. They're all very similar, except theirs has, I would say, a slightly more elaborated list of questions. So you're establishing parameters for an assessment. You're doing an assessment first. They're a little bit closer to defining the problem before defining the solution. Design a community involvement process. They want that to be a solution finding process. Develop an assessment and communications plan before you do it. Conduct your assessment, or in fact, it could be program and then communicate your findings. So that whole process is less about, it's not as easily used for something that's like a brand new HIV research project, for example, but it is probably a little more usable for something like a budget. Sorry if you can hear my son, he's really in the whole other part of the house playing a video game really, really loudly. It's not worth trying to tell him to stop. So, but this process is a little bit more process dependent and less about actual concrete program in the community, but it can be used that way. Sorry, I'm trying to advance myself. Go ahead, Mark. So this is the Seattle process, which I clearly didn't feel like retyping. So theirs is very similar. You're setting what your outcome goal is. Theirs is a little bit more QI based. So what is the actual concrete number or income level or whatever we're trying to achieve? Involve the stakeholders and analyze the data with community, determine benefit and burden, advance opportunity and minimize harm. So that is always your goal. It's to minimize harm or advance opportunity. It can be either. It may not be negative for anybody, but it should have a positive. If not, it shouldn't be a neutral program. And then evaluate and raise racial awareness. So people should be aware that you are doing that, of trying to create racial equity. It's not an undercover part. They want it to be an actual stated goal. And then be accountable, meaning report back. So theirs is less about, a little bit less about what you do in any particular part. It's a little bit less prescriptive in some parts and more in others. So their community assessment process is a little bit more elaborated, for example. Go ahead. And so that what all that looks like is different in different places. So I think this is the Seattle worksheet. This other one I think is Boston, actually. So plenty of people have it as essentially a worksheet that people turn in along with whatever other presentation. We actually piloted something like this for people who were doing clinically based research projects. Like if you wanted to use one of the clinical spaces, who have you talked to? So we know how to do that, and we've done something relatively similar. So all of this could be how it looks, and then you would get your presentation and this form. You could have it be the way we say put in the org chart in the front of your presentation. It could be a simple set of standards. We want these 4 slides in your presentation, and decide what should go on those. There are some ways in which we could do this. It depends on how much of the oversight burden you want to have versus how much you're just reporting on an oversight burden that the department has. So for example, if you have this as a form and somebody has it, that's fine, and that's their part of it. And then what you want to know is just the little bit that's in the presentation. Those are two different levels of involvement, and it could be either. It will take more than either of these for people to actually use these tools. There's going to have to be some period of training. We're looking at different community engagement as one of the pillars of this year's Equity A3 for the department, trying to get some standards set, some resources set, establish some roles for different community groups or ambassadors to be people who deliver feedback. So setting up some of those structures is going to happen. At least I'm going to start it this year, but in some areas it exists already and some it doesn't. So it'll be a bit harder for everybody to do the entire tool right away. And some parts of the department, like PhD, may do a much easier job than, say, primary care. So it will be a little bit uneven, but that is unavoidable, really. But we can all get towards a model of what the final standard is. Go forward, Mark. So here's a possible timeline. Our goal was to have the next fiscal year, starting in July, actually start to show some use of it, and that would give me a few months to do at least the beginnings of training for those first presenters. That really depends on when and how you choose. So we've put in our racial equity action plan. You getting options today. You select a tool sometime in the next month or so. I did start to do trainings the month after that, do a few months of trainings for at least the first summer's worth of presenters to know. And you may get partial adherence in July, much more fully developed by September, but it certainly will be phased depending on what people are doing. Hopefully we'll have done it in time to get some part of a response in the budget presentations. And just some level of community engagement process started. You do have a little bit of idea of how to go about that, but all that could happen within a few months, but likely we would just be starting to see the results of that for you in July, August, September. And then hopefully by a first few months, maybe by October or November, we could look back and do some evaluation of how this has gone and whether or not that was useful. Go forward. Last one. So I had a few questions that I got, and I can answer those, but I want to ask if there are any other questions about how this might look or work, or what would you like?
Thank you, Dr. Bennett. It was great. And yes, I was one of the ones that submitted some of the questions, of course, but I think what would also help me, and I think possibly the other commissioners, is with some of, like with GARE and the Seattle one, if you had accessibility or whatever to share an actual, I mean, we've got the outline, but an actual walkthrough of a proposal or of a program, or that both the tools or the top tools, a couple of your top tools of what you think would be relevant, if we could have those or see those to really understand the how this process goes through implementation of a that would be helpful.
So in the brief that I gave you, I went through a mock-up of what one might look like for the budget process. I can get one from GARE, I assume. It will belong to some municipality, I assume, so they'd have to get it from a partner.
That's fine. Yeah.
And I probably can get one out of Seattle. I didn't quite do that because I wasn't sure if we were going that route or if we wanted to do something else, but I can get an example from either of them.
It just, would help me because I saw the Seattle worksheet and I'm liking, is there more? I mean, what else? I think would be helpful.
Okay.
I had a similar response, and so that would be helpful. And Dr. Bennett, is it correct that the department itself is using the GARE toolkit?
So we are not. We use a lot of GARE tools, but we are not formally using this racial equity toolkit. I don't think anywhere in the department. Other things from GARE, yes, but not this formal process.
So my understanding is with partnering with you, we need to, in these discussions, in collaboration with you, come up with a tool that we're going to recommend to the Health Commission to implement. Am I correct?
Right. So you can do that two ways. You can look through the tools and say, I want to pick one. You can give me a sense of what the parameters you're looking for, how concrete, what kind of output it should have, and then I can give you some more narrow recommendations about one or two that might look like that, whether it need to be very specifically tailored to health or not. If we have a very clear set of asks, like you want to know a relevant health disparity with any project, which is a different thing and not really present in the tools per se. The community outreach process is immature in some places and mature in others. So if we want to really emphasize that, it will take a lot of development in some areas that need not be quite as much an emphasis if it doesn't seem as if it's as central as the more racial equity impact part of it. So it really can fit what your priorities are. And so that's, I would say, a place to start, is deciding between yourselves if you have a set of priorities already of what seems the most important or the most useful going forward.
So it seemed to me that Dr. Bennett, this would be conversations in addition to having it at the committee and in addition to having it and the full commission. This might also be a conversations that needs to happen, for the finance and planning committees, because like some of these tools like address specifically around budget, and for me, from my standpoint is, it's not much of an equity discussions if there's no, economic impact attached to that.
Mm-hmm.
So, like that would be some, like a place that I would like to see that we schedule a conversations as well, maybe with you and also with Michelle, to look at, like how these tools would look, to get a better sense of it. It's hard to get a sense by just looking, like on paper.
Okay. I think Mark's going to try to pull up the examples that are at the end of the brief.
Yes, and while I'm doing
So just those questions while you're doing that. So in terms of how you would evaluate the usefulness of the tool, there
Yes.
are a couple of ways you can do that. So it always matters what it is we're evaluating. So we can evaluate a standard and whether or not it meets it. So we can evaluate whether or not people are successfully using it, meaning just able to do each part. We can look at the level of community involvement. Is it just informing? Is it joint decision making? And decide what the standard should be, and just talk about whether people meet the standard of use. I would say initially that's probably where we're going to have to stay, because I think it's going to take some time for people to get used to it. We can always evaluate how it's accepted. There is a very significant, at least a significant recommendation that the community have a big role in this. And so how it's accepted or viewed or how it changes community interactions or community feedback would be a separate way of evaluating whether or not the tool is successful in doing its job, because that's a huge part of its job. And then the last way would be looking at specific metrics around health and health equity. So wanting to look at how much of the budget is going to some neighborhoods with this process, or whether or not the demographics of who uses programs changes over time. Because you would expect both of those to be impacted, right? If you say who's burdened or who's having a hard time using a program before you put the program in, hopefully you would find those burdens and mitigate them early and get more people who might otherwise not go in it. You would be driving more money to places you might otherwise not have given it to. So we can look at but that means you need to have either set a baseline or even better, some goal of what we want it to be. And I'd say in the beginning, we'd be setting baselines.
Okay, and I understand that. And I was just hoping that, maybe built into the tool could be, year 2, year 3, as far as its sustainability, to have some, like you mentioned, more qualitative feedback versus just the metrics and quantitative and the standardization is, because I guess what I'm also hoping for is that this is a tool that trickles down. It's just not the senior leaders, the presenters, the top tier, so to speak. It trickles down to not only the staff who do, let's say, an initial review of a proposal, but also to those seeking contracts, et cetera, to understand in a staff way what this tool means.
Yeah.
And so that's what one of my questions was, more that trickle down to the staff online, to the on the ground staff, to really understand the point of this.
So I do think that the way it's constructed, it is impossible to stay as a leadership thing that people just plug in, because it's hard to do a community engagement process and really do community evaluation of who the burdens are without actually having done that. I mean, I'm sure people can try to do it in a negative way, but I don't think our staff would do that. So to do that process requires that the people who are in the weeds of the program actually are involved in that part of it. I would think that it would advance something we've already been trying to do, which is move to a more lean management style, which includes respect for all voices, and it's meant to elevate the role of line staff and the role of practitioners in those kinds of programming decisions. So we've already been trying to move in that direction, and this would really require that, because I don't think anybody from a management level up is going to successfully do some of the things that are required for this. That kind of background research, the kind of community engagement.
Right.
So I think inherent in the tool, it requires a little bit of that. I would be slower to move it to the contractors. And the reason I say that is that we have had bright ideas that we have pushed out to the contractors without having it be very clear for our own staff first. And it has caused a lot of confusion. Trauma-informed system, like we've done it a lot, and it ends up being a checkbox because we haven't actually changed the culture for the contract graders and the monitors and those people who just are, did you check that box? So rather than do that, I would suggest that the grant makers who are actually going to be in it with them and writing the RFPs, that those people have their time to get into this. And then it moves on to become a requirement for the community groups and the contractors. Because before that, we tend to burden them with our learning process, and they're very small, and I think it's an unequal burden for us to have ourselves have an equal burden to them. We should figure it out first.
Okay, great. Thank you.
You're welcome. Yeah, I forget. So what you're seeing on the screen is the format in which it's reported to you, I think, is is less important. I mean, it can be on, I can make a worksheet in whatever way we want to compact the reporting, I think is not as important. What I do want to show is, so this is looking at a project we're actually doing. So we're getting a bunch of money out of the reallocation of the law enforcement dollars, public safety dollars, sorry. And so we're looking for how to do, if we look at how to do that as an equitable process, and we're going to use this tool, we already have the Human Rights Commission completing the public input process. So they've been doing a community priority setting process. So in this case, it's happening, we're just not directing it. So that process developed a set of priorities and then describe the program. So this would be not a sentence, maybe more than a sentence. So redirecting that money from public safety to Black African American health services and initiatives. And I think we're getting 36 million or something like that. And then what are the intended results? And some of that is broadly in the ordinance, and some of that is in the priorities. I did not include the priorities because remarkably, they've been working on it for months and we still haven't seen them all. But in that space, I would put those community stipulated outcomes. So the communities will be resourced to address harms and the legacy of racially disparate policies on health, housing, and economic outcomes. That comes straight out of, I think, the mayor's announcement. DPH will develop sustainable partnerships. Again, that was and innovative programs that comes out of a very clear community direction that we not spend it on anything we already do, and that it does something to change who we work with and what kinds of programs we offer. So beyond current services, and that our services in the community be more effective and will decrease health disparities. And that one is very much probably ours more than even communities. People don't always have target conditions, but we do. So all of those are the intended results. So looking at how we're going to achieve those results without creating inequity or actually reducing inequity. So it's meant to produce all of these things. We actually are not the primary folks on the housing or economic development, but because those are the goals, I would include them. There's lots of data. Keep going. I didn't put it all in there, but where's it supposed to impact? Western Addition, Bayview Hunters Point, Viz Valley, OMI. You could certainly look at that. And as you're reviewing it and asking questions in the presentation, ask, are those the only places? Is the community not distributed more than that? Why are we doing it in multiple communities? You could certainly interrogate why that decision was made and who it's going to benefit or burden by doing that. Are there people who'd have to travel now? Services to public housing will be explicitly included. How's that going to benefit? Look at what racial makeup of those groups are. You should be getting that data if that's what's listed. Services will be available to residents with recruitment, cultural concordance, and location being used to ensure access. So we know we can't say it's the Black program, all Black people come only, but what are the mechanisms they're going to do to make sure that those people come? So that may not be something you would normally hear in a presentation, but you should hear it based on this. What does the population level data show? So there's lots of health disparity data you should be getting. You should get at least some sense of what the group needs. So what are the things that we would want to target? And what are the current resources? We've been really struggling for years now to be able to say how much money we allocate to any particular need or group, partly because everything's for everybody. But we are getting better at it, and we're going to have to get much better at it. So this will help with that, for people to have clarity around who the target populations are, not who the exclusion populations are. Everybody can come to it, but who is the target in this, and being able to attach that information to programs will really help us when we're later looking at what's the equity between groups in terms of utilization. So what performance level data do you have available? So what are the data we already have? And that's where you're setting your outcomes. Is it just a standard? Is it, actual utilization? And what are the data caps? What additional data would help? So what are we missing? So how are communities engaged? There's been a whole process, so I didn't really go into it. What are the strategies to advance racial equity? So there are lots of questions to help you develop that answer, but you should have an answer. So how is this going to actually change racial equity in some way, which we don't always ask programs to describe. What's your plan for implementation? So that's just a quality issue. You should already be hearing that. And then how will you ensure accountability, communicate back to the community? So all of those things, some of those are things you would normally already hear, and some of them are not. So we don't always talk about how we'll tell the community about what we did. I'd say we often don't. Who's going to be accountable for the result? Sometimes we do that, sometimes we don't. So all of those things are really, it's about setting a standard way of doing this work and a standard way of judging what's good or not. So it's not as technocratic as some of the other change methodologies we use. It's a little bit more impressionistic than that, but it should be something that gives you different information than you normally get in terms of making your decisions.
Dr. Bennett, is there one model that you prefer or that you recommend, or are you leaving this completely to the commissioners?
I'm leaving it a bit to you. The GARE and Seattle models are fairly representative. And I'd say the GARE one is common, like it's what most of the others are based on. It is not that different in some ways than what we already do with lean, and we actually did do a lean for equity. I had a contractor and I wrote a lean for equity playbook a year or so ago that we never finished because it got, the world blew up. But so we already have some methodology around how you would do an A3 that included all of this information. So we can do it several different ways. I actually think the format's a little less important than what your priority are and what things you need right from the beginning. Because if we really want to emphasize the community process, we probably want to put off when we ask people to really start to use this and really train and resource a little differently to emphasize that part. If we want to just start to get information, and that's not the core, and it's really about, did we understand the part about what the impact would be? People can start doing that now. They all have different levels of difficulty about them, and some places really emphasize the community engagement part and don't so much care about the others, and other places really, like the Seattle one, really leans on the impact statement more than anything else. And so there are different ways to do it, and they don't all have to weigh the same.
Thank you. Commissioners, there is one person on the public comment line. Commissioner Gerardo, is it okay if I just ask? If you would like to make public comment on this item, please press *3 to raise your hand so that we can recognize you. *3. Okay, there's no hand. Any other questions, commissioners?
So, Dr. Bennett, it looks like this example of the GARE toolkit, the applied example of GARE toolkit that we've just gone over, was done for the budget proposal August 4th of 2020.
Mm-hmm.
And so if we had this process at that time, then when we had a presentation on this, we would be talking about each of these underlying areas, correct? And we would be thinking about the answers to these questions. That's correct.
You should be getting the answers to those questions. So you would be looking at whether or not you think that's a good enough answer.
Mhm.
So someone should be able to tell you, we looked at the reason we chose these areas is that here is the demographic breakdown of those areas. And we thought with transportation issues, we want to be in any neighborhood with greater than double the population of African Americans of the whatever. They should be able to explain how what they're doing is going to benefit the group they're intending and how it's not going to create any unintended consequences. So you should be able to hear that full explanation when you hear the program.
And this may get into whether or not we have a worksheet or not, or some kind of outline. It would be helpful to me, from my perspective, to have these questions in front of me when I have when we get these presentations, and and then we can see, just depending on how someone lays out their presentation, we can go line by line, or point by point, or we can have these as questions that we know that we want answers to, and as we listen, figure out, as you just said, whether we've received the answers that we need. I'm just trying to figure out what in practice what this would look like for us.
So it is meant to be fairly rigorous, so it should be written down somehow. So whether or not that comes to you as a worksheet, or whether or not that's the format, the information that they put in, what is their usual A3 format of whatever their format of programming is, we can impose on that system and say we want an actual reported out in this particular way. Or you can ask for it in whatever format that they normally do it, and then ask for the slides to include XYZ. So I would say it has to be written down. The whole point is that it has some rigor behind it, and it's not just suggestive, that people should be able to go back to it, because you have to say, what do the community want? What do I have to report back? So it really, it's like an environmental impact statement. You wouldn't want them not to have that really well detailed out as you arrived at problems later on.
And so whoever's reporting to us may have they've developed their own tool that they use in doing this, or are they using, or are they taking the tool that we choose and laying it on top of their work?
They're picking your tool and laying it on top of their work. So whether or not they should be able to report back, my suggestion is, whether it's a worksheet or it's an outline, that it comes back to you in some written form. It may not be, there may be more detail that is not in front of you. Like, for example, there may be quite a lot of data that is not necessarily delivered unless you ask for it, but here are the data points that we used. But you should get something written. Whether that's an outline of a proposal, or whether it's a click on the thing worksheet per se. I would say it's probably easier for us if we do it as a worksheet, so that you have a standardized format, and we can easily do that on a Google worksheet or something, and give people a sense of how much detail you want, by how much we want them to write about it. So it's not, there are a couple different ways to do it. The simplest is to probably put the questions in worksheet form, let people know, and we will train to it that way. How much of it you want presented, I think, is a separate question.
But at least we'd start with the standardization of a worksheet that would be part of every presentation or every program, so that I guess my concern is I wouldn't want to dig for it, that it would be just a standardized format. And if then there were further questions based on the format, that would be the forum in order to be able to do it. Am I correct? Okay.
And we can use one of the tools out of the box. My suggestion is that there's probably a little bit of health wording you want in there for the programmatic stuff, to know it's a little bit vague, because it's meant to be used about putting up a park or doing a city budget. So it's a little bit broad. So there may be some more specific health disparity or health specific stuff. And I can look into how to incorporate that, but there's certainly a health in all policies or health impact statement world that can be integrated into this a little bit. So I'm happy to mock up what might be a useful worksheet to follow this. I can just guess at what we want to weight things towards, but you do have to weight it one way or the other.
I know that Commissioner
What I need in terms of how much detail you want about something, I can give you 2 pages on what the community impact process was and what community said and who you talked to, or you can have that be fairly brief. And that will determine how much effort or work or time goes into such a thing.
I believe that Commissioner Chung has some questions, but I
You're
do also,
out on my board, but go ahead.
can you hear me?
I can. I don't see everybody. Let me open
Okay.
it up so I can't see hands, but go ahead.
But I did want to follow up on something that she did say about having a presentation of some kind to the Finance Committee, because I think that, and I think that it actually would be good for us if we can to work that kind of touch into each of the subcommittees, because what we, I'm telling you this, what we do is based, deeply in health, right? And providing health services to people. And, I know that I find it incredibly helpful and deeply important for physicians on our commission to hear the answers to the questions that they ask based on their knowledge of procedures and things like that. So I think it would be important for us before we, or I don't know what as we take it to them, or as we begin to talk to the full commission about the tool, that we highlight that and somehow give them a chance to work with it a bit in the context of the subcommittee work that they do as well. And that's just a thought that came to me based on, in part, on what Commissioner Chung said.
Thank you, Commissioner Christians. And yes, that's part of like what I am also curious about, because like in terms of these like racial equity tool, it seems like it has like two ways of looking at it. Of course, like one is the big picture, the macro, but that's also the micro, which is go into nuances, including what we have control over. For instance, in the finance and planning committees, like we have to like be approving, renewing contracts, or hear about corrective action plan, and all that, and that also might be a place, like to like create certain layers of transparencies, so that we know exactly, like how some of these contracts that we've been funding perform, like under the racial equity umbrella, in terms of like how far actually we were able to use these tools to benefit the communities that like we are trying to set out to really reach, like in a deeper way. So I would really like to have these conversations, that would help guide us, at least, to, start to think about how to do things differently, because this is definitely, a big change in some ways. And this is definitely, reminding us that it's not about business as usual. Like some of the contracts that we've been renewing for the last 10 years might not be a good fit, like moving forward, and these can be quite hard conversations at times. And, I imagine it would be, and so I think that we do have to have like some of these guided conversations, by your team, like so that, like we can create an approach that everyone agrees with.
Well, I think there's going to be I think it can take several conversations. I'm happy to do multiple conversations. And maybe it helps to have a mock, like just a pick one, and then you can pick what about that might need to change, and that'll help us decide on whether or not to change to a different one. And I'm happy to do that multiple times with different groups. I do think that we're going to have to see people try to apply it. So I may pick some coming up presentations to try to see what this might look like at the beginning, at least to start. It will have to ease in, because it'll take some, not just training, but resourcing to do it fully all over the department. So it'll be much easier in population health because they already do some of this, but not necessarily the outcomes part. They don't do that part as much. The outcomes part will be very easy at the hospital. The community engagement part, not so much. So there will be a learning curve everywhere, because nobody does, I think, all of this as fully as is being asked.
I think your suggestion of doing a mock-up first, and it would be then being able to then use your mock-up with possibly an example of a phantom proposal or even an old proposal, so that it's concrete for us to be able to look at. And then it would be then, as the other commissioners said, sent and discussed at the finance committee as well. And I think that would be very helpful to take what you presented and put it to something that is real, so to speak, in going forward.
Do we want to mock up a contract and a grant, or what kinds of things are the work that you would most want to see how this would work in? What kinds of things would you be looking for?
I'd like it to see it in a contract, because I'm hoping then, which was one of my questions too, is that this would be part of every contract that we are reviewing, because that's how we're able to then make the shift, not only for ourselves, but also for the different community providers who are trying to contract, who are contracting with us. And so I'm looking that it goes both ways. So I think it would be helpful. And if you feel that the GARE would be the best and most comprehensive, to start as a mock-up model for that would be great.
Okay, I will do that. I will find a contract. Let me think through with either the general or Laguna Honda, maybe even primary care, what a clinical program might look like. It's a little harder to think what that might look like, so I'll try to do that as well.
And Dr. Bennett, so this is obviously, am I correct that this is meant to also be a statement to the people who are doing the work of what our priorities are in some way? So for instance, just looking at the applied example of the GARE toolkit that we have, number 3, under step 1. What does this proposal have an ability to impact? I kind of feel that maybe we want to generally perhaps say these, list some and say, how does this proposal impact these areas? Does it or does not? And if so, how? So, to signal that, these are our priorities, that your proposal, what we're discussing, isn't having a positive impact on it, then that's a problem for us, to have it be a statement of what our priorities are in a way, drafted in that way.
I think I can draft that. One, because I think there's often room to be much more specific about what the health disparity we are trying to get to. So we sometimes have health programs, but don't necessarily pinpoint what gap needs to be closed. Yes, we all want to do Hep C, but what gap are we trying to close at the same time that we're doing that? So we can certainly do that. The other is the social determinants of health that make that circle of what your health impact is broader. I don't think we always think about the economic role that we have in some of these contracts, or the barriers that are those social determinants that this either fixes or doesn't fix or is going to be burdened by, like is transportation, what other social determinants or social deficits will impact this, or will it be impacted by? So we can certainly do that. And that's a little bit more of bringing in a health impact assessment model, which is how are people going to be better or worse off after this?
Mm-hmm. I think that would be very important to us. And, what comes into my mind immediately is how does this proposal impact someone's likely interaction with the criminal justice system, for instance, or incarceration, given that we are identifying incarceration and things like that as health issues for the community as well. So I would, especially as the community is demanding and we all want to be able to do something to have an impact on what's happening on our streets in the Tenderloin, for instance. And so having the work that we do and the work that people are bringing to us and doing the very good work that people are doing every day, be explicit about, okay, what can we do and what should we be doing to have an impact on that? So those are my thoughts about that.
We'll take that into consideration.
Thank you. Thank you, everyone. Dr. Bennett, when could we have a look at the mock? We don't have a committee meeting next month, but we can definitely have a 3:00 one, possibly, Mark, before the would a month to do a mock-up be enough time for
Yes.
you? I know how busy you are, but if
This is a big central thing for us. So yes, that's enough time. Either I can deliver that to you for you to look at, and the committee meeting can be not necessarily at the same time, but I definitely can get it to you in that time frame.
Okay, no, that would be great to get it to us ahead of time, but prior to the commission meeting, on March 2nd, I'm just thinking if we commissioners, if it would be okay with you, if we met at 3:00, just to take the time to focus, since I believe, this is really one of our committee priorities, to be able to focus on it. If that's amenable, Commissioner Christian, Commissioner Chung?
Commissioner Gerardo, I'm sorry, but on the second, the Finance and Planning Committee meets from 2 to 4 before the meeting on the 2nd. So I'm wondering, could you all join?
How could they?
But could you join the Finance and Planning Committee and have this as the last item on that agenda, and you all could be part of that committee meeting? I'm happy to talk to you all offline and figure out how.
That's fine with me. That's fine because it was going to be presented. And if you could then present it to them in their packet for that committee meeting, Mark, that this will be part of the discussion. This will be the discussion at 3:00 or whatever. And for us to join, because Commissioner Chung, you're already on there, right? So
Yeah,
it would be your schedule.
So I'll be the liaison. I'll volunteer myself.
You'll be the liaison. Okay. Would that work for you, Commissioner Christian, the 3:00 time then?
I believe it would.
Okay. Okay. So I think we have a deal.
Yep.
Okay. Okay.
So that's presenting that at the end of that meeting, and then the general committee presentation after that, which would be a little bit different. Okay.
I just want to thank you, Dr. Bennett, for all the work that you put in this.
Yes.
This is really exciting for us, and this is really important as well. And I know that, like how much time and effort you all have put into this, and we want to make sure that we do right by you. And so, like we might ask a lot, and we might, ask your support a lot, but that's only because we really want to get this off the ground with the right foot.
I want to do as much as needed. Something I want to be sure of is that you guys own the tool, that it is yours and you use it. It gives you what you need out of it for the role that you want to play, and that we are making it something that is really going to change the way people are doing their work, not just something that you can tack on at the end and try to quickly fill in your worksheet, but gives you a standard, that there's an inherent standard in it, as Commissioner Christian was saying, that it puts your priorities into it so that people are really understanding what you want before, so that you're not constantly nitpicking with your questions to try to get people to understand they understood coming in what they were supposed to bring. So I think it can really be a helpful tool, I think, for you guys to really be able to help hold us accountable.
Thank you.
I just want to join Commissioner Chung's comments and also say to you that for me, I'm so grateful for your expertise on this, and please always maybe overshare, because I want to make sure that, if you have in mind something that we might find helpful, or you think that you want to make sure that we're keeping in mind, please, don't be shy.
Okay.
Yeah, and also I'll just conclude this with, and please don't hesitate to reach out to us ahead of time. If you want to send it out and say, give me feedback or whatever, please don't hesitate, because I know how it is one of our priorities, and I know you've done a lot of work on it, and it's extremely important, and thank you for this.
Thank you. I'm looking to you guys to get a bunch of our positives out of this year are going to come out of you. So I'm hoping we'll be really close on this.
Thank you.
Okay. All right.
Commissioner, is it okay to move to the next item? And Dr. Bennett, can you stay for the beginning of it so that we have the overlap? Item four is a draft resolution for the Ramaytush Ohlone land acknowledgement, and we've got Dr. Jonathan Cordello, the chair of the Association of the Ramaytush Ohlone, here with us. And I want to first thank you for your attendance and your assistance with reviewing the resolution. And I'm happy to let you say a few words if you like to begin. I don't want to get in your way.
Thank you, Mark, and thank you all for inviting me here. It's my honor to be with you here today. And Dr. Bennett, that was an amazing presentation. So I'm, of course, all for racial equity. I do a lot of that kind of work down here at my university. So always appreciative of it, especially when it's data-driven, right? Let me just give you a really quick little bit of background so you understand what the sort of momentum that's building up here in the city and county of San Francisco over the last couple of years. And that's especially been heightened recently, of course, by the impact of not just the Black Lives Matter movement, but the sort of repercussions of that, so to speak, here in California, and how that translated. But well before George Floyd, we had the Indigenous Peoples Day proclamation that came into place just a couple of years ago, the formation of an American Indian Cultural District, now the formation of an American Indian Cultural Center, and now we have formal land acknowledgement statements by both the Human Rights Commission that's really started it, and then that was sent forward to the county supervisor's office and the mayor's office. So there's a lot going on right now in the city and county of San Francisco. There are school renamings. There are other groups doing land acknowledgement statements. Folks are looking into curriculum at the grade schools, and I can't keep up with it all. So my colleague Greg and I are the only two active members of our tribal organization. And as you can imagine, for both San Mateo and San Francisco counties, there's a lot to do. So I'm happy to be here. And I want to say just at the outset here, before I let it, give it back to Mark, that he did a really fantastic job writing this. So Mark, this is very well written. Thank you.
Thank you very much.
We still got work to do, but
no, of course. And it basically was a Human Rights Commission resolution that I added some language. So I want to completely give their process and all of their staff and all of you the kudos for that work. I like to give the commissioners something to react to. So commissioners, that document is basically the Human Rights Commission. I'm not sure if you all want to add more public health language, or if or how you want to move forward with the discussion. But I thought that made sense to begin. So how about if we turn it back over to you and you ask questions, or you all lead the discussion?
And if you don't mind, Commissioner Geraldo, I just want to claim a bragging right, because this original resolution was passed while I was the president of the Human Rights Commission, and I don't even remember if like Commissioner Christian joined us at that time yet, but this was definitely one of like the proud moment for us, to be able to really recognize the lonely men and the lonely people, and really recognize the discriminations by omission. I think that's what the report was called, and and the importance of this, as we move forward when we talk about racial equity. So thank you, Mark, for bringing this in as well. So I just want to say that before we continue with our discussion.
Thank you. And I also, what I didn't introduce this is, as Dr. Bennett mentioned for the past item, this is part of the Racial Equity Action Plan. And so this was on the template. Every department in the city is going to be doing work on this. And so our department seems to be ahead on several measures, which is fantastic, but it also means that y'all are doing some groundbreaking work. But know that this is that was the motivation to begin at this level. And as Dr. Cordelio and I talked yesterday, the process from the community perspective sometimes is that there should be a relationship before we do this kind of work, but the manner in which our bureaucracy has moved forward with this is that we're doing this kind of work, and hopefully it will strengthen the relationships we have with the community. And so my hope is that that this can be a step in that direction. But again, I'm turning it back over to y'all. I see Commissioner Christian's hand.
Yeah, thank you so much. Before we start with anything substantive, I just wanted to note a couple of things that are completely not substantive. I think on the 6th whereas, there is just a typo. It goes theft, forced assimilation, and other atrocities driven by local, stated. So that D should just get lost. State. And then I had a question on toward the end, now therefore be resolved paragraph. I don't know whether it should be, any of this should be in quotes, beginning with the San Francisco Health Commission, and then ending with, at the very last line, as First Peoples, because then we go into, and be it further resolved. I don't know structurally what should be done there. And if anything, just to set the statement itself apart from the rest of the language. And I had a question about in that paragraph, the San Francisco Health Commission / San Francisco Department of Public Health staff. Is that meant to be a choice depending on whose meeting it is?
Yes.
Okay.
And if I may interject really quickly, there's still a question around whether the end result of this will be that you all pass a resolution just for yourselves as the Health Commission, and or direct the department to do something, or include the department in the resolution. I put this in, Dr. Bennett and I and others feel like it makes sense, since you all are the policy body, to make these decisions on behalf of the whole department. It could be quicker and more, I think, a concise process. So that's why I kind of nudged you all in that direction.
Thank you. So those are the non-substantive comments that I had.
I've noted them. Questions or comments, commissioners?
I do have like a comment or maybe questions, because we talk a lot about social determinants of health, in terms of like racial equities, and, and also, like different communities, and, and also about, cultural, like cultural sensitivities, to these various, like communities of color. I think that might be something that we had unfortunately lost some of it, like when we look at how we as the cities and been supporting, like Native Americans who are living in San Francisco, like, and who are getting services, like, and I feel like, that whole conversations about, like, like culture seems to have been lost, like when we look at, healthcare and the delivery of healthcare and, like not able to really, bring the culture aspect, especially, like for some of the, the practices, like of the first people, in that area. So I'm not quite sure how we address it because it does speaks to the larger issues, such as, some of the issues that the communities have been facing, such as, like difficulty accessing, cultural appropriate substance abuse treatment programs, and also, like other culturally appropriate, services that complement, like their healthcare services here in the city.
Commissioner, just so thank you. Just so I'm understanding, so are you suggesting that in the resolution that there be more information regarding health access issues and disparities to note, because this is a public health department and you are the health commission, that the resolution would reflect that in addition to kind of what's on the page?
I think that for me, I think that it is really about, like our own, I can't speak for the entire department, but I think that, like our intention here, like to really acknowledge this and pass a resolution like this is really look into the health equity issues faced by, the community. And, and I think that those are not things that we've adequately addressed at this point in time.
Thank you.
Can I add to that, Mark? So, one of the things that's really interesting about this resolution is it's focused on the Ramaytush Ohlone peoples. So it's our group. But if we had our way, we would like actually it to be broadened out to include American Indians and Indigenous peoples, so it's more inclusive. Because we've had San Francisco, of course, has had relocation of American Indians, and of course there's a lot of very large pockets of Indigenous folks in San Francisco itself. And to get at some of that language, you might approach the folks at the American Indian Cultural Center and Sharia Souza in the American Indian Cultural District to help you broaden out some of that language to make it more inclusive of those populations. So Commissioner Chung, I think, is sort of pointing to that, right? That we should broaden this out and not just make it about us. And by the way, we wouldn't want that anyway. So I was hoping this would come up in our discussion. We do want to make this so that it's something that the city recognizes, not just about you're on our territory, so to speak, but that there are other Indigenous populations here that certainly need assistance.
Thank you.
I would like to also second that recommendation of Commissioner Chung's, that since this is for the health department and that versus other departments, there should be a whereas that specifically states health inequity, and it can include Native Americans and what was just, the full, gamut in that thing. But I do believe that there should be a whereas that specifically addresses health inequity and access.
Can I make a suggestion? That the beginning of this is that one point is to acknowledge the origin story of the land that we're on, but the other, whenever we talk about a group, is always to reiterate our commitment to the equal health resourcing. It's always to reiterate our commitment. It's unusual for us to talk about a group without having that commitment restated. So maybe it's a two-part thing, acknowledging the land, but also making that open commitment. That's not just about being on this piece of land, but about acknowledging Indigenous people as people with equal access, not access, but equal obligation. We have an equal obligation to them that we should openly acknowledge.
Thank you, Dr. Bennett. You articulate so much better than I had this. Yes, and that's exactly what I meant. Like it's one thing that we acknowledge the land we're on, but it's another that we make the commitment to, to the first people of this land, like as a whole, and I think that is what's asked of us to do at this point.
Mhm. I agree.
Thank you all. May I ask a question? This is to everybody. With those thoughts, would you, which would really enrich this document and the integrity of this, would you be suggesting that the statement itself that would be read at every public meeting be changed to include that, or just the resolution have whereas and also for the resolve that has some of these sentiments? Because those are two different things. One is, a statement at every meeting will be read that might be much more inclusive, and the other one would not. So I just want to make sure I'm getting clear direction from y'all and input.
I think it maybe in both parts, what would be read at the beginning of every meeting would acknowledge the history, but also the need for health equity. I think it would need to, that's what we do and that's what our focus is. So I would want, at least my recommendation would be to include a sentence of the history and about the health equity as we go forward. It would be that's my suggestion. I think it would be a little more impactful.
Yes. Any other thoughts? Thank you very much, Commissioner.
I agree.
I would agree in the sense that when we encourage people for people who approach us and want to write land acknowledgement statements, we don't write them for them. So we encourage people who write land acknowledgement statements to tailor them to meet their own needs. And so that what Commissioner Gerardo just said makes complete sense. That we start the statement by recognizing the original peoples, which is the sole purpose of a land acknowledgement statement, but then we tailor it to fit the needs of the Health Commission. So I'm in full support of that, and we can work on the language. I can help you with the language on that.
Thank you so much.
I'm happy to help as well. And I just want to be sure that one of the things I always like to be sure whenever we're talking about Indigenous people is that we don't only talk about history, because the presumption in this country that there are no people anymore and that it's a historical story is really, really strong. And so always talking about the present, I think, is always a good habit. So yes, we acknowledge the history of the land, but I think we do always have to say something about the people who are alive right now, not historically, and what it is we're doing for those people. So I think even if that's a sentence, and that those people continue to be our neighbors in this area, and this is what we are obliged to do, something even as that short, I think would be worthwhile, even just to balance out that misconception.
Thank you, Dr. Bennett. There are a few people in the public comment line, and I don't want to ignore them. If it's okay, Commissioner Gerardo, I just want to check in. If you're on the public comment line and would like to make comment on this item, which is item 4, please press *3 so we can recognize you. *3. Okay, I don't see any. Any other questions, comments, feedback, or input? All right.
And about what we're going to call it, do we stick with part of this this title, the land acknowledgement? I mean, is that something that is desired, and land acknowledgement, and then go on to say whatever else we want to say about it, or can we reframe the name fully acknowledgement of the original peoples and the our equitable goals for our community? Not that would be the name, but do we need to keep, and do we want to keep, land acknowledgement as part of the title is my question. Just Mark, so that you know what we're asking you to do.
Dr. Cordelia?
Yeah, it's Cordero, by the way. So yes, I agree. I think it should just be, since it's a two-part, it'll be a two-part statement. It should have a two-part title. Because it is a formal land acknowledgement, right? And it also is a sort of like a declaration of inclusivity of, all indigenous peoples in San Francisco as well.
Thank you very much. I will maybe draft some. I'll get to work on the draft and then send it out. Is that an okay process for you all? Or would you like to offer language? I want to do whatever feels most comfortable.
I think between you and Dr. Bennett, you're going to be, I know, at least more articulate than me in being able to put that together.
Okay. Then I will touch base with Dr. Bennett, and then I will loop everyone in. And of course, we'll be in touch with all the community that we can talk to. Thank you. Any other last comments? And Dr. Bennett, thank you for staying for this. That was very helpful to have your input, of course.
Yes, thank you, Dr. Bennett.
It's nice to meet you, Dr. Cordero, and I'm hoping that you will not be asked by every department in the city, and we should figure out a way for that not to happen by doing something so that that doesn't happen. So I will.
It's too late. It's too late.
No.
We've even gotten the San Francisco Ballet. So.
Well, it's everybody. So
yeah,
okay.
That's everybody, right?
All right. We should pay you for your time. Anyway, okay.
Yes.
We should pay we should at least pay the organization for your time. Something.
Something like that. We'll figure it out later.
We'll figure it out. Okay.
It's maybe something to bring up at the HRC meetings, Dr. Bennett.
Yes, I will talk to them about it because there should be a standard rate. We'll just work it out. I'll work it out with Shakira. We'll call you. Thank you. Bye.
All right, commissioners, moving on to item 5, emerging issues.
And Mark, is it okay if I leave now?
Yes, thank you so much. I will be in touch, and thank you again for your time yesterday and for today. We really appreciate it.
Thank you, commissioners, very much. It was a pleasure to be here with you.
Thank you.
Thank you.
All right, commissioners, emerging issues. Anything? I also asked the folks in the public comment line, press *3 if you'd like to make a comment on emerging issues. Okay, we can move on to public comment, which is item 6. If you'd like to make public comment on general public comment, please press *3. All right, and then we're at a consideration for adjournment.
So moved.
Second.
I'll do a roll call. Commissioner Chung,
Yes.
Commissioner Christian,
Yes.
and Commissioner Gerardo.
Yes.
All right, thank you all so much.
Thank you.
Okay. See you in a half hour.
Yes, and Commissioner Christian, I just saw the issue on the minutes, so thank you. I'm going to go through and comment before the meeting.
Okay. And Mark, I had a comment, further comment about my comments from the last meeting.